temptation is to assume that if it comes and it goes, it's safe, but actually just one episode of blood in the urine is and should be taken seriously. You may not be having it actually when you see your GP, but he would still like to see you because there are some tests that need to be done to potentially investigate further the cause of blood in the urine. And there are special clinics taking place in lots of hospitals around the country further investigating blood in the urine, and this can involve simple blood tests, urine tests of course, also x-rays, and potentially even putting a tube into the bladder to find out the cause. So many patients who have blood in their urine are subsequently found to have an abnormality in one of their kidneys, or the kidney cancer was identified on a routine scan, and that might or might not be within the context of having blood in the pee previously. One of the questions then is, what is the treatment, and do all patients need to have an operation? And the answer to that is no. There are a group of patients in whom have very small abnormalities that we can watch. There are some abnormalities that may or may not be cancer, and we need to go in and biopsy those to confirm the diagnosis. And if it's not a cancer, we can obviously observe those as well. And then there's a third group of patients where sometimes we can freeze or cut off a blood supply to the cancer if they're small enough, and therefore we can prevent the need for an operation. However, if you have a kidney mass that's well defined on a scan, the standard treatment would be to have that surgically removed. So let's assume for a second that an operation is going to take place, and thousands of patients in the UK have their kidneys removed every year. If an operation is going to take place, there are different types of operation that can occur. They could either be open operations or laparoscopic, that's keyhole surgery, and we even now do robotic surgery used to remove just part of the kidney. And the recovery times for these newer types of surgery are quicker than the old types. So instead of being in hospital for a week, you're in hospital for only 1 or 2 days. The operation takes about 3 hours to perform. And we like to say that the blood loss is less than half a litre, 300 millilitres, for example, a can of Coke. That sort of blood loss is what we would expect. The surgery is routine and performed regularly. Occasionally, if the cancer moves or spreads or goes into the blood vessels, the surgery becomes more complicated. And under those circumstances, often a team of surgeons, including liver surgeons or gastric surgeons, are required to make the surgery work better. So I think overall, the majority of operations are routine. We've got some new novel machines that help us with those operations, but there are some more complicated procedures that take longer to recover from and are more challenging with side effects. This Blood in the Pee campaign applies to both men and women, and it's important because we think that it will improve the outcome of patients with kidney cancer if we can diagnose these cancers early. So I urge you, if you do have an episode, go to your GP and get it sorted out, get the peace of mind, but also if it is a cancer, it will increase the chances of us curing you in the future.